Let me begin by asking you just to give me a quick general overview of your center, what type of services you provide, the population you help.
Sure. So we are a community health center in the South Bronx. We're surrounded by many public housing units, both large projects and private vouchered housing. And we serve a very underserved community. And we have a lot of challenges providing quality health care to a very needy population.
All right. So let me begin by, what is the importance of public housing primary care programs in your community?
Well, the public housing primary care program has been really wonderful for us. One thing I think that is huge is this conference. When we get together and meet, it reminds me that we're not alone, that many of the centers represented here are faced with the same challenges as we are, and we're not operating in a silo. And in fact, it's really provides a lot of support, encouragement, and inspiration to come to a meeting like this and learn from each other and realize that we're actually part of a network that can really affect powerful change if we all work together for the same goal and improve the health of people in public housing.
All right. Now, in terms of the impact that you have on the citizens that you work with in your community, tell me about that.
I think we're able to do an extremely good job of providing high-quality care to our public housing residents, especially because we really build on the family systems model of care. We try to look after families who are in public housing, from prenatally through early childhood through old age. And I think that that really builds on the strengths and the resiliency of people in the community. And many of our patients have been coming to our health center for decades. And, you know, that provides a great strength to the sort of care we're able to provide. We really know our patients, they really know us. And we really try to know all the resources in the community and work with them to offer the best overall care that is available.
If you can you think of any one or two success stories or impact that you may have had on a particular family in your community?
Gosh, I can think of many. We have a very strong HIV program in our site. You know, unfortunately, HIV is a big problem in public housing, particularly in the South Bronx. And we have built a very successful HIV program. And some of the stories out of that really exemplify a lot of the strengths of our model of care. For example, a number of patients, unfortunately, we diagnosed during pregnancy when they're tested for HIV, and I can think of one particular patient who we diagnosed in pregnancy, and that was 10 years ago now, and since then, you know, she's done fantastically on treatment. Her child was born uninfected and has grown into a healthy young child, 10-year-old, and the whole family has sort of been brought into care, and you know, that's a great success story. And kind of shows, and we involved all aspects of the health center in her care. We have a mental health component, we have a support group, we have the medical piece, we have the prenatal, we have the early childhood care. So it feels something like that is the sort of the wraparound healthcare that we can provide that's kind of unique to a community health center.
That's really what it's all about.
Yeah, sure, yeah.
What collaborations and partnerships do you currently have that have been helpful, and what others would you like to see that could also help?
Well, we work a lot with community organizations in the South Bronx. So we have a lot of tie-ins with community-based organizations who are able to provide supportive services. We have some nutritional programs that are both run out of the health center, and also people who come in and do help us do demonstrations in the waiting room to promote healthy eating. We've worked with farmers markets in the community to try to promote healthy eating. We have a great program called Starting Right, which is a collaboration with the local school, where we have an exercise and nutritional component for children who are either obese or at risk of obesity. So we have a lot of different programs where we connect with other community partners.
Those are great. That's fantastic. And finally, what barriers do you currently find in terms of stopping you from achieving all you would like to achieve?
Well, the good thing about the Bronx and the South Bronx especially is there's been a huge amount of development in the last decade. So it's great to see empty lots now with new buildings. With that also comes challenges, because we've got a lot of new families moving into the neighborhood. In fact, the space right opposite our health center was an empty lot for many years, and now is a 10-story residential, low-income residential building. So the demand for our services has increased accordingly. We're happy to say we are expanding. And so we're going to have increased capacity to look after the influx of residents into the neighborhood. But that's, access to care, we all know, is a huge challenge for low-income residents and patients. So that's just been compounded by the neighborhood growing. So we're trying to respond to that and increase our capacity. So we should be opening our expanded site very, very soon.